Next up, we have for you Dr. Yufei, family physician of Parkway, Shenton, executive health screeners at Gleneagles Hospital. Now, Dr. Lee is a family physician with very special interests in chronic disease management and women's health. Now, today she's here to talk about precision wellness. How do you make the most out of your health screening? So, ladies and gentlemen, Dr. Lee.
All right, hi guys. I'm Dr. Lee from Parkway Shenton, Executive Health Screener. So I believe most of you from the audience have gone through health screening in the past, but how do we make the most of it? So that's what I'm going to share with you today. So I practice at Executive Health Screener, Gleneagles Hospital. Right, so everything starts with this. What exactly is health screening? So basically, the health screening helps us to detect any potential diseases or medical conditions. Usually, it will include a consultation with the doctors and also a physical examination by your physician. So after that, there will be laboratory works done. There will be radiological studies done as well, and other diagnostic tests if indicated. So not only, my patient, some of my friends, even my parents, sometimes they will tell me that it has been a while since my last health screening and, can I just postpone it this time around? So actually, I know work is piling up, but actually one of the very common reasons that my patients share with me that why they put off the health screening is because they don't feel anything. So I don't feel anything means that there's nothing wrong going on in my body, right? But actually it doesn't work this way. So I always like to take diabetes as an example. So in the beginning, when someone has an impaired sugar levels, they might feel nothing. So they can go to work as usual. They can participate in the exercises, in the daily routines as usual. Everything is just same as usual. But as time goes by, after a few months or even after years, when this impaired sugar control just goes on, there will be this accumulative injury to the inner lining of the blood vessels. And that's when things started to manifest. Some people may have this craving for water that is so different from that baseline pattern. Some people may have a weight loss or weight fluctuations. Some people may experience recurrent infections. So although nowadays there are so many wonderful treatments for diabetes, but I would say if we can detect things earlier, in the earlier stage, it will be much easier for the medications to work, and it will be much easier for us to reduce the complications that is brought by this impaired sugar control. And I believe everybody agree on this. Early detection saves lives. Right, so let's move on. Right, so we have different types of health screening. So for the basic health screenings, they can be conveniently conducted within our GP clinics. So it offers a general evaluation of the health. It will screen for obesity, it screens for diabetes, high blood pressure, high cholesterol levels, etc. So the most commonly blood tests that are included will be your full blood count, whereby we are looking at how is the any anemias, how is the full count of your white blood cells, platelet, etc. And fasting sugar levels, fasting cholesterol levels. We will do a screening blood test on the kidney and liver function as well. So urine test can be performed. So in the urine test, it's not just a simple test. It tells us a lot of information, whether there is any sign of inflammation, any excess sugars, which can happen in those with impaired sugar, and any protein leaking from the kidney. And this can be an early sign of the kidney illness. And blood in the urine will be reflected on the urine test as well. So, and if say this person, they would like to have an even better understanding of the current health status, executive health screening can be done as well. So during this executive health screening, there are additional blood tests that can be performed. So this blood test might include the blood test for thyroid function. So this is to evaluate the level of the thyroid hormones. And in those with certain dietary preferences or certain lifestyles, we do have blood tests to check for certain nutrient deficiencies, like iron profile, like folic acid, vitamin B, like vitamin D as well. So selected cancer markers might be done as well for cancer screen purpose. Sex hormone profile, it might be included in the package. Hepatitis screening actually is to detect whether this person has immunity against hepatitis A or B, or is there any infection going on with hepatitis C. So in those who are concerned about sexually transmitted disease, certain blood tests, swab, or urine tests can be performed. So actually, I have quite a few patients that ask me, the stool test is so difficult just to submit a sample in the clinic, so can I skip it today? So actually, what I would tell them is that, this stool test is not just a simple random test. So basically, it tests for any occult bleeding from the digestive tract. And this is the screening for colorectal cancer. And so if you can, go for it. In selected female individuals, very importantly, cervical cancer screening tests such as Pap smear and HPV tests will be performed by your physician. And in those who have the needs for breast cancer screening or screening for other breast conditions, mammogram or ultrasound of the breast can be performed as well. And so bone mineral density, as you may see in this picture at the right side, so we are using bone mineral density to check or to screen for osteoporosis. And during the executive health screening, other radiological tests, including the ultrasound abdomen, ultrasound of the pelvis, ultrasound thyroid, etc., it might be offered depending on this person's health profile. So there are so many tests out there. So the test that may suit your colleagues probably may not suit you, or it's not the one that you need the most. So talk to your doctor and let your physician know about what you're concerned about, what you would like to know more about, right? So let's move on to heart health. We are talking about heart health day in, day out. You might have heard about this term called cardiovascular disease. So what exactly is cardiovascular disease? We're talking about it, so many times. But if you can just look at the picture, the right side, actually, cardiovascular disease is caused by this waxy fatty deposits that just falls underneath the inner lining of the blood vessels. So as it progresses, this fatty deposits accumulates, causing narrowing of the lumen of these blood vessels. So the blood supply gets compromised. So not only the coronary artery disease, or sometimes we heard about the term like heart attack, etc. Not only this coronary artery disease is under the umbrella of this cardiovascular disease. Actually, those illnesses such as stroke, mini stroke, peripheral vascular disease, or what we call the narrowing of the major arteries that supplying your limbs, and also certain aortic diseases are also under this umbrella. So now that we know what is cardiovascular disease, so am I at risk then? So when I talk about these risk factors, what usually I would like to categorize it into two different parts. So one part is that the factors that we cannot change. Yes, certain factors we can't modify. That include our age, our gender. We have different family history, and we come from different ethnic background. So these are the things that we cannot modify. But don't be discouraged. because there are a lot of things that we can do and we can change, including we can optimize our blood pressure control, we can optimize the cholesterol levels, we can screening for diabetes and get it controlled at the early stage, if any. Kidney disease is associated with increased risk of cardiovascular disease as well. So this can be screened through your routine screening. For those who smoke, smoking cessation is always great. And a lot of us actually nowadays, because of the busy work schedule, we tend to be sitting in the office all day round. So what I would suggest is that just take a walk in between, even like just a few minutes to break the cycle. That will be great for you. All right, and of course, diet is very important, and stress management as well. So what if I share some of the risk factors and how am I going to screen for it? So I always like to say there is no one size fits all. So again, the tests that work the best for your colleagues may not work for you. But to start with, usually what we do for the cardiovascular disease screening is that we will start with the blood works. So of course, fasting blood tests for diabetes screening, for cholesterol screening, and your blood pressure, all this will be measured during the clinic, the health screening session. Electrocardiogram or ECG will be used to look at any irregular heart rhythm. Some of you might be familiar with this exercise stress test, or we call it treadmill. So during this treadmill, the person will be running on the treadmill and the ECG recording will be ongoing. So the cardiologist will be reading your ECG recordings and to see if there is any abnormal ECG changes that might be suggestive of underlying heart illness. So echocardiogram is something that being used to detect any structural abnormalities of the valves, of the chambers of the heart. And in those selected high-risk populations, other tests such as calcium scoring or CT coronary angiogram might be performed if it's indicated. So CT coronary angiogram is a test that this will require injection of a special dye into the blood vessels so that it will highlight your heart arteries and it will tell whether any narrowing of the heart arteries, and if so, what's the location, and this will guide the treatment subsequently. So in a small portion of population, people may have started to have very high cholesterol from a very young age. So in this group of populations, the genetic test might be performed to check if this unusual elevation in the cholesterol at a young age, whether it's because of certain genetic alterations that you get from the parents. Yeah. So these are the screening modalities available, but do discuss with your physician to check which one is the most appropriate for you. Right, okay, so let's move on to the gut health. Right, when we talk about bacteria, I think a lot of people will feel that bacteria are bad. They cause infections, they cause inflammations, but actually they can be friendly to us as well. And we have a lot of bacteria in the gut. Actually, there are trillions of them. So it's basically just a community out there. It's a jungle out there. So what do they do actually? All these bacteria, they stay in the gut. They help to break down the food. They help the body to absorb the nutrients. The bacteria itself, they produce certain vitamins and also the neurotransmitters, which can be very important in mood regulations. And also they help to regulate our immunity. They help to fight against those harmful bacteria. And very importantly, they play a very essential role in maintaining our metabolic and mental well-being. So the bacteria in the gut is not only about digestion. They can be helping with the brain health, they can be helping with the immune response, they can be helping with the metabolism. So if this person is bothered by some of the issues that I've just mentioned, what they might do is that certain tests can be performed to screen and to look at how this jungle is. So currently, the gut microbiome analysis, it will be able to, just to use a stool sample to determine how is the diversity of this jungle out there. So is there any imbalance? So are we getting too little of the good guys? Are we getting too much of the bad guys? But of course, it's a jungle, so we're unable to list every single one of them, but it does tell us how is the diversity, and is there a need to work on that further? Because if there is any severe imbalance or any abnormal, unusual diversity that is noted from this analysis, some of the precision probiotics might be useful to help to regulate the symptoms. But again, do talk to your physician about the indication of the test and what you can benefit from it. Right, so it's not sleep time, but sleep is so important to us. So but it's something that usually is quite often overlooked. But why is sound sleep important to us? It's not just about have a good rest. If we don't get enough sleep, or you don't have a good quality of sleep for a prolonged period of time, we will feel tired. There might be elevated blood pressures. Our sugar tolerance might be impaired. It can lead to fatty liver as well. You might have heard about this term called sleep apnea. So what is sleep apnea exactly, or some people call it OSA? So basically, it's a sleep disorder that is caused by the compromised oxygen supply during your sleep time. That is due to the narrowing of your upper airways. Someone from our population, they might be at risk for it. That include those with high body weight, those who take quite a bit of alcohols, smokers, those with certain medical conditions, and also elderly individuals as well. Okay, a lot of us snores, but not everybody with loud snoring have sleep apnea. But that is one of the very common symptoms. The other symptoms of sleep apnea can include episodes in which you stop breathing during the sleep and then suddenly gasping for air. Some people, they may feel like headache in the morning. Sorry for the typo here. So it should be read as excessive sleepiness during the daytime. They might have difficulty paying attention during work. They might feel irritable. So what can we do? Of course, to keep a good sleep hygiene is so important. But if you're bothered by certain symptoms that I just mentioned, you might talk to your physician, see if screening for this condition called sleep apnea would be indicated for you. I remember in the previous times, the affected individuals, they had to stay in the hospital overnight to get this sleep study done. But nowadays, with the advancement in the technology, some of the screening tests for sleep apnea can also be performed at home. So during this test, this wearable device will be recording this person's oxygen levels, how is the pulse rate, how is the movement of the arms, how is the sleep, and so as to generate an idea whether there's any suspicion for the sleep apnea. And if so, actually there are nowadays a lot of great measurement, a great treatment that can be considered to improve the sleep quality for those affected by sleep apnea. And in the long run, it can reduce the risk of high blood pressure, fatty liver, or those with mood disorders. And for those who have concerns about their cognition or cognitive health, a digital brain function test will be an option to go for. Some people may ask about MRI scans of the brain. Actually, for MRI scans, it will be mainly to assess for the structures of the brain. So this will give us an idea how is the structure of the brain tissues and also the blood vessels. Right. And so actually, I do understand a lot of us also suffer from chronic joint pains, either from previous injury, trauma, or just from our sedentary lifestyle. So nowadays, with AI-powered technology, our physiotherapists actually they are able to evaluate or to assess for the strengths, the balance, the mobility of our joints more precisely using the different devices, and this will help them to one step further to help us to restore the movement and function if this has been affected by the previous injury or trauma in the past. And in those who are concerned about their body composition, etc., DEXA body composition analysis will be available as well. So again, there are so many tests out there, but I will still encourage you that, just to make the most of your screening, talk to your physician to share with them what's your previous, what you have gone through in the past, any past illness, any illness that run in the family, any concerns that you have regarding your health status at this point in time, so that your physician will suggest the most appropriate screening test for you. And that's the end of my sharing today. And thank you for tuning in during the lunch break.